Hello, everyone. My name is Joy Ibrahim. I am a nursing student at Rasmussen University, class of the care of the older adults by Professor John Hoover. What is neurovirus? Let's start. What is neurovirus? Neurovirus is a highly contagious virus that causes gastrointestinal issues such as stomach and intestinal inflammation. It leads to vomiting, dehydration, and nausea, um, and also stomach pain, usually lasting anywhere between 1 to 3 days. Neurovirus is one of the most common cause of the gastroenteritis worldwide. When I tell you this pathogen, its prevalence varies from season, locations, and population. And here are some key statistics in the next slide. Global prevalence. So, globally, neurovirus causes an estimated 685 million cases of acute gastroenteritis annually, and it is responsible for over 200,000 deaths per year. This is not a joke. It affects mostly young children, older adults, and people who are immunocompromised annually. But let's bring it home. Here in the United States, neurovirus leads up to 19 to 21 million cases of vomiting and diarrhea each year. It results in 109,000 hospitalizations and 900 deaths annually. And the older adults are the most affected group of persons affected by this pathogen. The outbreaks are usually in common areas like schools, nursing home, cruise ships, and restaurants. Incidents in older adults. Neurovirus is particularly common in older adults. Like I mentioned in the previous slide, it's especially common in older adults that are in nursing home and long-term care facility. This pathogen causes half of all gastroenteritis outbreak in these long-term care facilities. Over here, neurovirus complication in older adults. When I tell you that they have the most complex, severe complications, you will see that older adults are at high risk of dehydration and complication due to their weakened immune system. And most older adults have pre-existing health condition already. And think about this, they have decreased test sensation, so they don't even remember to take in fluids. So imagine having diarrhea and you're vomiting and you're losing all that fluids, you're losing all that electrolytes, and you don't even have any sensation to take water. You're not replacing those fluids. So we see this a lot that they suffer dehydration and so many severe complications. So adults anywhere from the age of 65 and older are more likely to be hospitalized due to neurovirus related dehydration. And when you see some severe cases, it leads to electrolyte imbalance and it can progress to kidney problem and even death in frail individual. That is why we have to be more careful with our older adults population. We have to be more intentional with them because they suffer the consequences, the complication of this pathogen higher than any other group because again I mentioned their pre-existing condition and the fact that their immune system uh, is weakening. Then in the next slide, what are the ways of transmission for this pathogen? So this virus is highly contagious and is spread through contaminated food, water, dirty surfaces, and person-to-person contact. So I've emphasized. I feel like I've overflogged this issue, and I mentioned that it's higher. The higher risk group includes children elderly adults. And one part that I never mentioned that I feel like we should bring into consideration are the healthcare workers. That's right. So the CNAs, the social worker, the nurses, the doctors, those that are in close contact environments. So they are at high risk. And sometimes we transmit this from cross contamination. So you take care of a patient or you provide care to this person who has neurovirus, and without performing the proper hand hygiene, we unintentionally go to the next patient and we can transmit this pathogen or this virus to the next person. So healthcare workers too need to be careful because you're taking care of a lot of older adults and you're going from one place to the next. Please make sure that you perform every proper precaution just to make sure you're not transmitting this virus from one person to the next. So we're going to talk about in the next slide, we will see ways to prevent it. So, treatment and prevention. Because there is no vaccine, unfortunately, for neurovirus for now, uh, the best way is to just prevent it. So, prevention focuses on good hand hygiene, proper food handling, and disinfecting contaminated areas. Honestly, perform your hand hygiene. I feel like we have to say this enough. And this could be seen in your NCLEX exams, and in most cases, the most effective common practice to prevent the spread of disease, germs, or anything is through proper hand washing. So please wash your hands. You could read about that in my citations below, but you could find out that that is one of the most common ways of preventing. And then food handling. Remember, I told you is one of the ways that can get, you can transmit this pathogen. So make sure that you're performing hygiene, you're washing your hands before you're cooking, you're not cooking in contaminated area, you're not leaving the food to be exposed to all these pathogens that causes neurovirus. But again, you might ask, what if the person already has it? Since there's no treatment or vaccination, what do you do? Now, if you've already contacted neurovirus, the best practice is to prevent the spread is to initiate contact precaution. So, in most cases, unfortunately, you might want to isolate the person because you, again, remember how it spreads. So, you might keep them safe and make sure that they are well rested and make sure that they stay hydrated. So encourage rest as much as you can. If you're a healthcare provider, you're providing care to someone who has neurovirus, make sure that you're also, initiating contact precaution. Make sure they stay hydrated. Make sure you introduce BRAD diets, which is your banana, your rice, your apple, your toast. Make sure they're able to take food like that they can tolerate, and monitor for any worsening symptoms. Again, their immune system is weakened. Remember, we all can have this neurovirus, but the older adults have weakened immune system, so it can degenerate to something else. So make sure you closely monitor them. They're resting, they're staying hydrated, they're eating, and they're well taken care of, and just monitor them. Make sure they don't progress to something else. So we will come right here in the next slide. Um, so I actually picked this particular topic for this reason: seasonal trends. Neurovirus trends in the winter months. Currently in the United States, this month is March. We're still in our winter months. So neurovirus goes anywhere from the month of November to April. That is when they thrive. In the cold temperature climates is when they thrive. And again, what happens when the weather is closed? People stay indoors, right? They all come together crowded up together indoors. Unlike the summertime when people are outdoors enjoying a walk in the park, but during the wintertime, people stay crowded up inside because it's cold, right? That is why I picked this topic. I'm a healthcare worker, and currently at my job, almost 60% of my residents are down with this neurovirus. So they're throwing up, they're having diarrhea, you see them very weak. Um, so you make sure you monitor them closely. I wanted to spread this awareness because this is actually the best season for a neurovirus to thrive. So this is the reason why I chose this topic, to educate you about neurovirus and how to stay safe and keep your loved ones and the patients that you're providing care to very safe during this season. In the next slide, we will talk about what will happen if they get any worsening symptoms. So while neurovirus resolves anywhere within a few days, so 1 to 3 days, at most 4 days, older adults should be monitored very closely. Like I said, I cannot say this enough. They have weakened immune system. They have some of them, most of them have underlying condition. They lose their thirst sensation once they get older, so they don't even drink much water. So they are at higher risk of dehydration. So please monitor them closely, and if dehydrated or any complications should arise, please, if they're at home, send them to the hospital where they can get treated. If they're in a nursing home, long term care facility, send them to the hospital where they can get treatments. And that's why I put this fine, fancy phone for you, showing you to just dial 911. Send them out, take them, drive them, do whatever you can, but get them help because it can lead to worsening conditions like even death, electrolyte imbalance, and even debt. So, well, moving to the last slide. These are citations, these are references where you can find all these topics on neurovirus. I hope that this is helpful because right now, a lot of nursing homes around the United States, around Chicago, where I live, or Illinois, you could see when you go to from one nursing home to the next, they're actually going through this right now. It's more like an outbreak in most of this nursing home. Again, remember I said is a seasonal trend. It thrives more in the winter weather. So you can read up on this resources. You can Google up this references that I put in, and you can learn more on how to take care of yourself and to take care of especially the older citizens that we are caregivers to. So I hope this makes sense. Again, my name is Joy, and I am a nursing student at Rasmussen University, class of the care of the older adults with Professor John Cover. Thank you.